I think I'm one of the few people that every day gets up and goes, yes, I could go to work. I love my patients, and I absolutely get more from them than I ever give to them. I truly wanted a mosaic in my office because I believe that everybody contributes something wonderful to our community. I did not want just a practice for poor people. It has been wonderful.
What's your secret to building strong patient relationships?
Empathy and love. They won't trust you until they buy into the fact that you're there for them. We're there to really educate and to help people understand health in terms of their whole lives. Pay really good and careful attention when you take a history, because that's going to give you about 60% of what you need. Be flexible and laugh. If you're not having fun, then there's something wrong. You have to be enjoying yourself.
Welcome to Unsung, the podcast powered by Duet, where we shine a light on the nurse practitioners who are breaking barriers, redefining healthcare, and proving that NPs aren't just the future, we're the now. I'm Dr. E, and in each episode, we'll uncover the untold stories of NPs across the country who are changing lives with their practices, making a real impact in their communities. Today, we have Harriet Hellman, NP. She's a pediatric nurse practitioner who has been serving the Southampton community for nearly 3 decades. In 1991, she worked at the local hospital and quickly realized that there was a deeply underserved population on the east end of Long Island. By 1995, she opened up her own practice to meet that need, one she describes as caring for a true mosaic of the community. Hellman is Spanish-speaking and has built a practice that now cares for a panel of roughly 5,000 patients from all walks of life. Her scope includes preventive care, chronic disease management, immunizations, and developmental health across pediatric and adolescents. More than numbers, she emphasizes the joy of work. She often says she wakes up every day happy to go to work. Her career reflects a commitment to equity, accessibility, and primary care, creating a space where language, culture, and circumstance are not barriers to be seen. Harriet Hellman, so excited to have you on the Duet podcast.
It's great to be here.
Oh my goodness. Okay, so before we get to your business, I want to hear about what made you decide to become a nurse practitioner to begin with.
Well, I actually went through the 3rd program in the country.
Wow.
I was in 1972. I was in Maine, and I went to the University of Maine, and I went immediately through into the Portland Public Health Department. And the Portland Public Health Department at that time was very forward-thinking. Eventually, 15 years later, I moved to New York City, and they were just starting to do things that we were doing in Portland at that time. And they already had nurse practitioners. And they had 2 nurse practitioners who were working in their clinics and in their community health centers in pediatrics. And they had they had planned to have 1 family nurse practitioner. So I worked for them as a public health nurse for a year. And then they sent me to Maine Medical Center, the regional medical program, which had a dual nurse practitioner director and pediatrician director. And it was actually modeled after Henry Silver's program in Colorado. And so I was just working with nurse practitioners. I could see in public health, I really felt like we were there to be physicians' colleagues, and it just worked for me. And I loved being in the community. So I went through the program, and I've never looked back.
Never looked back. So I imagine at first you did not open up your own practice right away. You worked for others?
No. I worked in Portland for the Portland Health Department in community health centers. I had my own clinics. And I was there for a number of years, and then moved to New York City and with the National Health Services Corps. And I was on the Lower East Side at NINA, which is Northeast Neighborhood Association on 3rd Street between C and D during the time of the heroin epidemic. And I ran an adolescent program for adolescents and their babies. The babies' fathers were all drug runners and sold heroin. It was a fascinating program, and I was there from 78 to 83 when I had my son. And after that, I worked in homeless shelters, volunteering. And then I went to the maternity center, which was the first freestanding birth center in the country, as their director of pediatrics, and had a practice there. And then eventually my kids had another one by that time, and they were in New York City. And I was finding out that it was $30,000 to go to kindergarten. And I said to my husband, no. I wanted them in public school. And we had a home in the Hamptons. So I moved out to that home and with the kids. And my husband would come out on weekends. And I worked for a pediatrician for 4 years. And I was the only one who spoke Spanish. I'm bilingual. And I didn't realize at the time that there was a huge underserved population in the Hamptons. This was in 1991. And so I got hospital privileges at Southampton Hospital. I actually wrote them for the hospital and was the first nurse practitioner there. And then I got hospital privileges at University Hospital Stony Brook. And then I said, I want to practice where everybody can come and where the medical assistant speaks Spanish, where that's culturally competent. And so I left my pediatrician colleague and opened my own practice. And that was 30 years ago.
Oh my God. What year was that?
That was in 1995. So it was exactly 30 years.
Wow. And 1995, and it was primarily for the underserved population of Southampton, Spanish-speaking population?
Because we were all bilingual and my staff was from many different countries, we got a huge number of Hispanics, but I wanted it to be, I go back to David Dinkins when he was mayor of New York. He said something I think is really important. It's been a guiding philosophy for me. And at the time, he said that New York was a wonderful mosaic. And I truly wanted a mosaic in my office because I believe that everybody contributes something wonderful to our community. So I did not want just a practice for poor people. Mm-hmm. And it didn't turn out that way. It turned out to be, I actually had some very affluent, and HIPAA requirements are such that I can't tell you, but I had affluent actors and actresses, and actually a daughter of a president's children it came to me, along with Salvadorian and Mexican and Central American immigrants, and everybody mixed together, and it has been wonderful.
That is amazing. How big is your patient panel at this point?
My patient panel currently is about 5,000.
Wow.
I take Thursdays off because we work Saturdays. And I think one of the few people that every day gets up and goes, yes, I could go to work.
Wow.
I love it. I love my patients, and I absolutely get more from them than I ever give to them.
I love that so much. And so it's just you. You're the only NP that's...
Currently, it's just myself, yes.
Okay. And you have a staff
If there's any nurse practitioners out there that would like to come, you're welcome.
I love that so much. You want them to come work with you?
Yeah.
I love
Oh,
that.
come on. I'll take you in a second.
I'm coming.
Okay.
So what's a typical day like for you at the practice?
Well, we start at 9, and we usually the two office managers and myself get together and kind of look at the schedule and brainstorm in terms of what our needs are going to be. Are there any specific things about of patients on the schedule? And we do have spaces for sick visits and walk-ins, although it's not a walk-in facility.
Mm.
And we see patients. It started in just pediatrics, but I can't get rid of some people. And so I actually have from newborns to my oldest patient is 32 and has been with me his entire life. So uh,
That's
that's kind of
amazing.
it. And we break for lunch and we finish around 5 to 6.
Oh my goodness, that is wonderful. Was there like a certain habit or a system that you've implemented that's been a game changer either for your productivity or for your sanity?
Well, in 2003, we became electronic medical records. And we used a system called Office Practicum, which is, I still use it. And I find it great because you can have certain templates. If you're going to say to patients things about medication, you're going to go through the risks, the benefits, the side effects, the when to call. And so you can do templates that are real. And that just saved writing down everything. Um, and I have found that to be a helpful thing.
Yeah. So you love your EMR. I think you're one of the few
I do
people.
love my
I think
EMR.
you're one of the few people in the world that love their EMR. That's amazing.
Yeah, but remember, I'm the boss, and so it's the EMR I like.
That's all that matters.
Yeah.
What's your secret to building like strong patient relationships?
Empathy
Mm.
and love. Can I give you an example
Please do.
from today?
Please.
My office manager is sitting in the office next door, probably listening to this, and we had a tough afternoon.
Mm.
We had a 7-week-old come in, and she was there for a rash, but she wasn't there for a rash.
Good.
She's a mother who has a 3-year-old, and she had a new baby 7 weeks ago, and the baby's father split, and so she's doing everything alone.
Mm.
And her breast milk supply went down. She is exhausted. And so the baby was not gaining weight. And we got the baby up to the 29th percentile. And I saw the baby 2 weeks ago, and the baby has lost 1 pound and 4 ounces
Oh
and is
no.
now below the third. And I was very worried. And she said to me that she stopped feeding the baby at night and she cut back on the amount of formula.
Oof.
And that's really scary
Yeah.
stuff.
Yeah.
And I felt like the real problem was, and this is a healthy baby, I felt like the real problem was depression and the
Mm.
fact that she was alone
Yeah.
and has no family helping her, and he had just kind of left. So my office manager, who's my right-hand person, and I spent time with her. We spent about an hour intermittently, and when I would leave the room, Jackie would go in and help feed the baby and comment how wonderful he was, and we got her to understand that she was exhausted, and she agreed to seeing a therapist tomorrow. We have a full-time therapist
Oh
in our
wow.
office.
That's big.
So she's seeing a therapist tomorrow, and we got her brother who came, who's young, he's a landscaper. He came to drive her, and she was allowed us to tell him that she needed some help. And so
Wow.
I think he's going to help her more. And I think the reason I say this, and I'm seeing the baby Monday, but I think the reason I used it as an example is I could say to her, hey, you're doing this all by yourself. And I've been a mom and I had 2 kids and you're exhausted
Mm-hmm.
and I care about you and I care about your children. I said in Spanish, sus niños están mis nietos, which
Aw.
means they are my grandchildren.
Aw.
And that's, I think, the success because she was able to hug us and leave. And I feel like we're going to be okay. She has my cell phone. She can call and the brother knows how to get me. But I think you have to have people, they won't trust you until that you really, they buy into the fact that you're there for them and you're not going anywhere.
Yeah.
And that's what's different about nurse practitioners, I believe. We're not there to just give a prescription across a desk. We're there to really educate and to help people understand health in terms of their whole lives.
Yeah.
And it's, World Health Organization many years ago, I think it was in the 40s, could have been 60s, I don't know, said health is not just the absence of disease and infirmity. And then the definition goes on, but
Sure.
it is everything. It's about who you live with, whether you have food, whether your mental health is good, whether climate is in, and what your whole life is about. And that's what I think is different about nurse practitioners is that that's in our education, that's in our philosophy, that we really, really have to look at the whole person and the whole family and within the community.
I love that so much. So with all this that you're giving to the patients, how do you balance your clinical duties with managing the business itself?
Good staff,
Good staff.
good staff. My people have been here for years,
Wow.
and we're a family. And I have to stop them from taking stuff home. They're wonderful, wonderful, wonderful people. They are, they are truly family to me.
Wow. So you have a office assistant and a med tech. What do you have? Who comprises your team?
We have 2 office managers. One is more clinical than the other, and she was actually my patient when she was a little girl.
Oh,
And the other manages the front desk and appointments. And we have 2 medical assistants.
wow, that's amazing. How do you stay updated with the latest medical advancements and integrate them into your practice?
Well, you don't keep your hospital privileges and you don't keep your certification unless you do those CMEs. So thankfully that you can do them on the web these days. And that makes my life easier because it's expensive to go to conferences and it's hard to get away.
Yeah, absolutely. So you like to go online. Do you have a particular source you like or anything
I
goes?
like AANP, American Academy of Pediatrics. I love ID. I just love ID.
Oh,
And
that's
so, you know, I read them all.
oh my goodness. What was some of the biggest challenges you faced when you're starting your practice?
It was unusual. Well, I think I was the second nurse practitioner in this community. Um, I was not the first nurse practitioner to have a private practice in this community. Beth Moran was there before me in Sag Harbor as a woman's health nurse practitioner.
Mm,
And she already had a private practice. But there was no one with hospital privileges. There was no managed cares were not um, attuned to nurse practitioners. And so part of the difficulty at the beginning was getting managed cares to buy in, and the fear that if they didn't, I'd go under. Um, Part of the difficulty was having physicians understand, if they hadn't worked with nurse practitioners,
Mm.
uh, who we were, what we were, and how we were their colleagues. And you only have to go through a few serious illnesses with children to have the guys in the ER go, "Oh yeah, she knows what the heck she's doing." And that happened. Um, and managed cares did buy in. That was another goal of mine with Hampton Community Healthcare, because I was bilingual. I was highly experienced by that time. I mean, I've now practiced 55 years.
Wow.
And I was there weren't enough providers on Eastern Long Island, and certainly none that were bilingual. So it was good because I could say to managed cares, "Hey, you know, you need me,"
Yeah.
and they signed on. They bought in, and and they also found that when they did the HEDIS, that yeah, all my kids were immunized, and I got all those qualifications.
Yeah.
And when they did their audits, we'd come out well, and we still do.
Oh my God, I love this
So
so much.
it's that part was the scary part, I think, more than anything.
And now, what are the challenges you face now?
I'm getting old.
So, like an
um,
exit strategy?
uh, working on that one. Working on that one.
No, that's
But
fine. I didn't know if that was a challenge. So what is
uh,
the challenge of getting old, and like why did you mention that?
well, my husband passed away
I'm so sorry.
last year, and I would like to have the ability to see my children, who are adults who live on different coasts,
Oh,
and um, uh, and I'd like to be able to take off and go see them. So
yeah.
you know,
And now if you take off, the clinic shuts down, right?
I always keep someone here, and I check in 3 times a day, and I use email, and they email me, the labs
Sure.
and I can get in from my computer anywhere.
Oh, that's great.
So, it isn't so bad.
What's the best piece of advice you've ever received about running your own practice?
Be flexible
Mm.
and laugh.
Oh, I love that so much. Did you want to expound on that a little bit?
I mean, we get too serious.
Yeah.
And if you're not having fun, then there's something wrong. You have to be enjoying yourself. I like an intellectual challenge. I like to learn something new every day. Clinically, I love science. I was
Yeah.
raised by scientists, and so I absolutely love science. And so I love the clinical part. But I also like very much the part where I can sit with you at 4 o'clock in the afternoon and think back to the young mother this afternoon and
Yeah.
feel like, I did change a life.
Of course.
I may have saved a life,
I think so.
but um, yeah, I think you got to laugh. You got to be flexible. When one of those happen, you have to kind of have slow down and take the time that it needs.
I love this. So now, going to you, what's a fun or surprising fact about you that most patients or colleagues don't know?
I love to hike.
Mm.
My time off, I like to take Leo, my dog, and hike in nature, and we really hike for like 3 hours, 4 hours at a time.
Wow. That's amazing.
And and A fun thing is I lift weights.
Oh, that's good. That's so important for longevity.
Yeah.
That is so good.
Well, I work out every day, 6 days a week, and I love exercise, and I like to feel strong,
Oh my gosh.
mentally and physically.
Absolutely. If you were not a nurse practitioner, what would you be doing?
Well, when I come back in the next life,
Yeah.
I'm going to be an international spy.
Ooh, okay.
But yeah, definitely. But because I've read more spy stories than probably anyone on this earth, I love reading those.
You'd be a spy.
That's yeah, I get lost in that literature kind of. Yeah, I'll be a spy in my next life.
I love that. Okay, last question. What's, most of the people listening to this podcast are starting out or thinking of starting out. What's a piece of advice you want to give to those nurse practitioners who are at the beginning of their journey?
If you're at the beginning of your clinical journey, it all goes back to history. Pay really good and careful attention when you take a history, because that's going to give you about 60% of what you need. It's not so much the
true.
laying on of hands. It's history. And establish how you think very carefully about territoriality, how you sit. Are you inviting people to talk to you? Are your arms crossed? Are you showing interest in how you lean forward when you're talking to people, so that patients see your interest and are willing to tell you things that they want you to know. I think history is very, very, very important. Find a clinician, another nurse practitioner, preferably, who, because we have the same philosophy, who is experienced, and work with them and run things by them and go over cases with them and cultivate those relationships, because they will help you to see things that you might not know about. The fact that somebody's itching an incredible amount could very well be liver disease, and you don't think of that if you're just starting out. You're thinking of eczema and allergic rashes and all that, and it might not be that. There are giraffes and there are zebras. Not everything is. When you hear hoofbeats, it's usually a horse, but it also could be a giraffe or a zebra.
Absolutely. So listen to the story and find a colleague that you could tell your stories, like you've found some cases off of.
Yep. And also, don't think because they're specialists that they won't talk to you, because they will.
They will.
And because if you start your practice and you are wrapping that referral in a bow and tying it, and you've sent the labs, you've sent a letter, you've sent it all to the specialist, they're going to appreciate that, because they're not getting that from other providers. And so, yes, when you call or email them, they're going to give you their cell phone, and they're going to pick up the phone when you call. And so wrap those referrals in a bow. Show that you read every single solitary consult note back, that you know what they've said, and you've followed up with them. And email them back and say, hey, yes, I did schedule them back for the labs that you thought might be helpful in 3 months, and I'll make sure they're in.
I love that so much. Closing that loop is so important.
Oh, so important, because it gets lost.
Absolutely.
It gets lost, particularly in this era of managed care and and how fast the world is going.
Yeah, everything's so fast. That's amazing. These are amazing words of wisdom, Harriet. I cannot thank you enough. Thank you so much for agreeing to be on the podcast.
Oh, it's been lots of fun.
That's a wrap for today's episode of Unsung. If this inspired you, share it with another MP who needs to hear it. Don't forget to subscribe and leave a review. It helps more MPs find us and fuels the movement. Want to join the largest MP practice network? Learn more about Duet on our website, joinduet.com. Until next time, keep pushing boundaries and proving what NPs can do.